Okay, good morning, everyone. I see a lot of people signing in. I'm Adrienne from the Lupus Foundation. We're just going to give it a couple minutes to make sure that everybody has a chance to sign in and get comfortable, and then we'll get started. So just give us a minute here. Definitely have a lot of people signing in. Okay, we'll wait just a few more seconds here. I see people signing in from all over. Good morning to everyone. It's so nice to have you here, and it's nice to be together again virtually. Okay, let's go. Thank you for joining us for this educational program. All participant lines have been muted to ensure the audio quality and provide a distraction-free learning environment. At the end of each presentation, we will allow for a short Q&A session. You can use the comment section at the right, and we'll do our best to address as many questions as we can as time allows. At the end of the program, we will send you an evaluation. We ask that you please provide us with feedback to ensure that we best serve our lupus community and provide engaging future programming. You will also have a chance to win one of 2 gift cards, and they're good ones. So stay tuned to the end of the program to learn more. I want to take a moment to read a brief disclaimer. The Lupus Foundation of America, Greater Ohio Chapter, does not give medical advice to patients regarding their lupus treatment. Your physician is the best source of information regarding the medical management of your lupus. This program is available for informational and educational purposes only. The information provided by other providers and/or professionals within the context of this program is not necessarily the opinion of the Lupus Foundation of America, Greater Ohio Chapter. We will now begin the Rise and Thrive Virtual Lupus Summit. Thank you for joining us. My name is Adrienne Fernandez. I've been dedicated to the mission of the Lupus Foundation of America, Greater Ohio Chapter for over a decade. I'm also a patient, so I understand a lot about the struggles that you face on a daily basis. I appreciate you all being here. As you can see from the agenda, we have an expert panel joining us from the Ohio State University Wexner Medical Center and Nationwide Children's Hospital in Columbus. I want to take a moment to recognize the Ohio Department of Health. Partial funding from this program is provided by an earmark from the state of Ohio and managed by the Ohio Department of Health. We would not be able to hold important programs like this without their generous support. I'd also like to thank our audience for joining us and learning about living your best life with lupus. Our first speaker today is Dr. Kelly Wise. Dr. Kelly Wise is an advanced patient care pharmacist for the Division of Rheumatology and Special Pharmacy at Nationwide Children's Hospital. She primarily focuses on medication access and patient education within rheumatology. Her quality improvement and research efforts have surrounded improving time to therapy for biologic therapies, safe use of teratogenic medications in females of childbearing potential, and transition readiness for young adult patients. Dr. Wise is speaking today about making medications work. Dr. Wise, welcome. The virtual floor is now yours.
All right, thank you. And just to confirm, you can see my slides okay, correct? Okay. All right, so just to get started today, I'm going to talk about no blame, no shame, how to win the medicine game. I wanted to start off with a kind of reflection activity. So as you sit there today, I want you just to drink your coffee or close your eyes, and I'm going to read through some quotes of some patients with lupus that I want to see if they resonate with you. So the first one is, I don't really see a difference if I skip a few days of my medicine. If I'm traveling, my routine is thrown off and it's easy to forget my meds. I am not a guinea pig. I don't have very serious symptoms. It doesn't matter if I take this medicine. I hate prednisone, but my doctor always wants to use it. What choice do I have? Sometimes I feel good with no symptoms, but the medicines have side effects. I just want to be a healthy person. I went home and did my own research in order to find out what the medicine does and what the side effects are. They don't always tell me the side effects, and it comes as a shock. And finally, I don't discuss this concern with my doctor because it's a bit of a position of power and you still need help from that person. It can be really hard to speak out. And as I mentioned, these are actual quotes from patients with lupus. They were based from a survey researchers met and interviewed patients with lupus and tried to identify barriers to taking their medicine. The results of that study actually helped those researchers identify those barriers and then create some solutions to help overcome the barriers. And we'll talk through a lot of those with today's presentation. I have no financial disclosures regarding the content of today's presentation, but I do need to disclose that I'm a pharmacist and I forget to take medicine. So I wanted to introduce you to my dog, Henry. Henry's on a seizure medicine, which he has to take twice a day. So it is one medicine, but I found myself forgetting to give it to him quite often. So I had to resort through some of the tips that we're going to talk through today, such as using a pill box in order to remember and make sure that he's getting his medicine on time. So just know that if you're missing your medicines, you're not alone. We're all human. So hopefully we'll talk through some tips to help you kind of manage the medicines a little bit easier. Objectives of today's presentation are to review the benefits of medications in systemic lupus erythematosus. We're going to discuss barriers to medication adherence and methods to overcome those barriers at home, and understand strategies to promote self-management of medications. So we can't talk about the benefits of these medicines without at least laying the groundwork for what lupus is. So systemic lupus erythematosus, or SLE, is a chronic multisystem autoimmune disease. It can affect your skin, your lungs, your kidneys, your hearts, and several other organs. You likely have a good knowledge of lupus if you're here. So either yourself or a loved one has lupus. Um, it can affect, up to 150 per 100,000 individuals. And it's hard to diagnose because if we had a full room of patients with lupus, most of them have different symptoms at diagnosis or different symptoms when they flare. We do know that it affects females more than males, so typically of the childbearing age, but it can be diagnosed at any point in life. And it may be related to genetic, hormonal, or environmental factors. The interesting thing with lupus is a lot of our treatment options are treatments that researchers or providers had stumbled upon that they worked. So it wasn't until more recent years that we've actually had more targeted medications that are specifically studied in lupus for that treatment. And that's really exciting, but it took us a long time to get there. And it's not uncommon for people with lupus to have a long list of medications to treat various aspects of their condition. So this is an example of a medication list for someone with lupus. And, full transparency, this is likely oversimplified because it's not taking into account possibly other medicines that you're on for other conditions. But one thing that's really important for me as a healthcare provider is when I meet with my patients, I walk through this list of medicines, not to just confirm if you're taking it or not, but I want to know that you know why you're taking it. Because when I take a step back, I would not take a medicine if I didn't know why I was taking it. So, kind of briefly walking through this list, we often use vitamin D supplementation, helps keep our bones healthy, especially with, the use of other medicines that can increase the risk of osteoporosis long term. Mycophenolate is an example of an immunosuppressant, so that medicine kind of helps with the inflammation in your body. Hydroxychloroquine is an anti-malarial. So that's a good example of a medicine that we just like stumbled upon worked well for lupus. I like to call this your lupus vitamin because it helps prevent flares. Omeprazole is an example of medicine you might be on to prevent side effects to some of the other medicines that can be harsh on your stomach. Melatonin could be a sleep aid. Lisinopril could be a medicine that you're on to kind of control your blood pressure or protect your kidneys. And then everyone's favorite medicine is prednisone. Um, so we have a love-hate relationship with prednisone, but it is an anti-inflammatory medicine.
Dr. Wise, I am so sorry for the interruption. Your slides are not advancing. Are you able to do that, or would
Oh,
you like to switch over to Alex doing them for you? I apologize for the
That is
interruption.
okay.
There you go.
Let me try to. Is this
Maybe in
advancing?
we're there now. Yeah, it's not. We can see the to the left your actual little slides. So I don't know if you're in full presenter mode.
Okay.
Um,
Let me just. So sorry about that. Let me try this
that's
again.
okay. I just wanted to make sure I didn't want to interrupt you while you were speaking. But
Um, let's just.
bear with us, everyone. We will just be
Yeah.
with you in a moment. You know how technical difficulties work in our world. We're
Uh,
used to this at this point, right?
okay. It's not letting. We're gonna try to share this one last time.
We'll see
And
if
so is this presenter mode that you see?
it's not. And you know
It's
what?
not.
I know
Okay,
we were having some problems with that. So either we can have Alex take over and advance the slides for you. Does that work better for you? Okay,
that's
let's see if
fine. Yep.
we can get him. There we go. That's
Okay.
perfect.
Yep,
All
there's
right.
Henry.
Okay. All right. Now
Um,
we get to see everything. All right. He'll get to the right
okay,
slide and we'll keep going. Sorry about the
okay.
technical.
That's okay. Next slide. Okay, so so sorry about that. Goals of therapy. So when we have this laundry list of medications, our goals are to relieve pain associated with lupus and reduce inflammation. We also want to reduce long-term complications of lupus and improve and maintain physical function. Next. While doing this, we want to focus on the psychosocial impact of these medicines. So, really minimizing that on your overall well being and improve or maintain quality of life. And then finally, we always want to balance these benefits of the medicine with minimizing those side effects. So, we want to prevent infections or other complications of treatment and maintain optimal adherence to medicine. So, what is medication adherence? Medication adherence refers to how a patient takes medicine compared to how it's prescribed. So, are we taking the right amount at the right time, in the right method, and for the right duration? Medication adherence is important to positive health outcomes, particularly for chronic conditions. There's lots of research surrounding medication adherence, and um, literature presents that adherence in lupus patients at about 43 to 75%, kind of depending on how they measure adherence. And the national average for adherence to medications is around 80%. So in lupus, we're actually seeing lower rates of adherence compared to that national average. And I can't talk about the importance of adherence without talking about honesty with the clinicians. So if I have a patient comes in a clinic and reports that they're taking all their medications as directed, and then actually aren't taking medicines, we have a lot of safety risk with that because if we're in a flare or we feel like the medications aren't controlling the disease, we often increase doses or add on additional medications when really that might not be the safest option for them. So it's really important to be open with the treatment team about these issues with the adherence. Um, there was recently two large studies that were surveys of patients that assessed how honest they are with the clinicians, and it assessed various factors of their healthcare, including, if they withheld not understanding instructions from their doctors or not agreeing with their doctors, information about how often they exercise or their diet, and then, and purpose of this presentation is information about their medicine. So whether withholding not taking medicines, or if they're taking too much medicine, or taking someone else's medicine. And in these studies, they saw, upwards of 80% of patients were withholding some type of information from their doctors. And the primary reasons were they didn't want to feel judged by the provider, or they were embarrassed, and they didn't want to be lectured by their providers as well. So, once again, just in order to use medications as safely as possible, it's very important to be honest and open both ways of the relationship. So the clinician and patient relationship requires honest and open communication between both parties to maximize therapeutic benefit and avoid potential harm. So why do we not take medicines? This is has multiple factors that play into this. The first one is forgetting to take the medicine. I'm sorry, I think there might be some issues with this slide setup. Um, can you advance quickly? Okay. I can just talk through some of this stuff. I think there's some information on our slides that aren't pulling in. But when we forget to take medicines, I refer to this as unintentional non-adherence. So it wasn't that you didn't want to take the medicine; it's just that we kind of forgot to take the medicine. So as humans, we have on average 6,000 thoughts going through our mind every single day. So kind of adding on remembering to take medicines is very difficult to do. So I want to rely on other tools to remember to take those doses. Examples of that would be using a pill box. Pill boxes are wonderful because on one side, you're not having to open up all your pill bottles multiple times a day. You just do them once and fill the whole pill box. It's also that visual reminder of your medicines. So it prevents you from getting into autopilot mode where we go about our day and then we think, oh, did I take my medicines or not? And then oftentimes, if we're not sure if we took them, then we don't take them because we don't want to double up on our medications. Um, so the pill box is a great reminder on if you actually took your medicines. I often rely on phone apps or alarms, as well as medication lists of all your medicines. So I love medication lists because with those lists, you can actually utilize it to fill your pill box. So if we have an individual on 10, 15, 20 medicines, it's very easy to have one that ran out of refills and then you don't get it from your pharmacy anymore. And you don't even realize you don't have that in your possession when you're filling your pill box. So when you use a medication list, you can kind of work down the list and fill your pill box as you go to make sure you have all your medicines at your home. I also link up. You can go back one. Yeah, thank you. Link up medications to activities you do every single day. So, in your terms of your daily routine, people link up their meds to when they're brushing their teeth or when they're eating their meals, and that's incredibly helpful. And then finally, I rely on support from people in the house as well. So, if there's someone else taking medicines, you can take your meds together. That's a really helpful tool. So, shifting gears, we can talk about not when you're forgetting to take medicines, but when you might not want to take medicines. We could advance to the next slide here. So, reasons why we might not want to take medicines, lack of symptoms. So, if we feel good, we're not in a flare, and miss a dose, you might not feel a difference. And then it's easier to miss another dose and then skip a dose and thereon. As I mentioned, sorry. Many of these medications are used to prevent flares. So, by taking them routinely now, it's going to prevent that flare in the future. So, very important to kind of stay on board with medicines, even when you're not in a period where you're feeling ill. I always consider the role of mood, anxiety, and depression in regards to taking medicines. So, we know that people with depression are almost 2 times more likely to not take their medicines. So, if I'm meeting with someone who has depression, our goal is to link them up with a mental health provider to manage that depression, and then we can kind of tackle the adherence to their medications. Talking through all the tools to take medicines aren't really going to help if you're in a situation, if you're in a setting where depression is impacting your daily life. Lack of benefit. So, did we give this medicine an adequate trial? A lot of times people will try a medicine and then stop it because they feel like it didn't work. Some of these medicines can take weeks to months to actually work. So, we need to make sure that we did give it an adequate trial. And then, in any of these situations, whether it's lack of symptoms or lack of benefits, and we feel like we want to stop a medicine, it's really important to talk to the team about that. So, some of these medicines can be dangerous if we stop them cold turkey. So, really working on a way to safely taper off a medicine and then talk about if we need to trial something else in its place. I often see situations where we're not sure why we're taking a medicine, so we just don't take it anymore. That's where, Personally, I like to talk through all the indications with our patients to make sure that we know why we're taking our medicines. I mean, it also gives us the opportunity to really take a step back and ensure that, all the medicines that you're on are ones that you do actually still need. Um, as mentioned before, just don't be afraid to share any concerns with your treatment team so that they can adjust your meds as needed. Side effects or not tolerating medicines. With this, we can advance. It's important to discuss any side effects with the treatment team. You don't need to wait for an appointment to do this. So, if you started a new medicine and you feel like you're experiencing significant side effects, just give the clinic a call or send them a message. The provider can talk through either ways to manage that side effect, or if we need to switch medicines sooner, they might do that in between appointments or have you come into the clinic to talk through new medicines. But these benefits of the medicine should always outweigh the side effects. I don't want to see where you have been suffering through side effects for several weeks or months before you come and talk about it in clinic. We always want to make sure that we're not, putting you in greater risk by using these medicines. Injection anxiety. um, some of our newer medicines in lupus are actually medicines that you inject at home. And it's common to have either a fear of needles before starting these medicines or something that develops over time. So when you're starting an injectable medicine, it's really important to have hands-on training. So you can request an injection training from a nurse or pharmacist in your clinic. Sometimes there's also support through the manufacturers where they can review this with you as well. It's important to have a good support system at home. So I never, force our patients to do their own injections, regardless of their age. If they have someone at home that can do their injections safely for them and they feel confident with that, I'm okay with that too, as long as we're getting those doses in. Because sometimes what we see with injection anxiety is we start to delay the doses. It might start by delaying it a couple minutes, like, I want 5 more minutes, I want 5 more minutes, and then it turns into hours or even days or just completely avoiding the medicine. So for people who are anxious about these injections, we want to try to create that positive injection environment. Um, we utilize all sorts of non-pharmacological interventions, such as using essential oils that you can breathe in. So, like a lavender or peppermint to kind of calm the body. Deep belly breathing in for 5 seconds, hold for 5 seconds, release for 5 seconds. I have a lot of people who listen to headphones just to kind of tune out everything and take it. Kind of remove themselves from the current situation. We also want to make sure the person doing the injection is positive and confident in their skills for administering it. And they can always reach back out to clinic if they need more help. In situations where we have significant injection anxiety, in our clinic, we work very closely with our psychologist team. They can develop a more individualized plan for our patients. And then finally is medication access concerns. As mentioned, we have these newer medicines that are like targeted therapies, and a lot of these are considered specialty medicines. We can advance the slide. So with medication access concerns, um, not only are these specialty medicines, but we have situations where we might not have insurance at all. So paying for medications out of pocket, whether they're specialty meds or not, can be very burdensome to individuals. So I recommend working with your resources in the clinic. So whether it's social work or financial counselors, helping to link you up with insurance. The manufacturers often have patient assistance programs where you can get medications at either a reduced cost or fully covered. So there's lots of resources to help you through lack of insurance coverage to help maintain access to the medicines. Drug shortages can impact access to medicines. So, we had a hurricane this past year that impacted lots of suppliers of IV fluids that came out of North Carolina. So, we never know when a drug shortage is going to hit. A drug shortage hit the lupus population about 5 years ago to this date, where if you remember, hydroxychloroquine was touted as a very effective treatment option for COVID. And within 1 month in Ohio, dispensing of hydroxychloroquine increased from 6,000 pills per day to 53,000 pills per day. And this was an unexpected increase. And with that, we saw a dramatic impact on our patients having access to this vital medicine. So the treatment teams and the clinics are always working on backup plans in this situation on finding alternative pharmacies or other medicines if there is a drug shortage. And then finally, that specialty medication aspect. So these newer medicines can cost on average $5,000 a month. And these medicines have lots of barriers to actually get started. So we have to do prior authorizations through insurance to prove that you require this medicine. So that's sending lots of chart notes and information about your diagnosis and past meds you tried and failed. They do have to be sent to a preferred specialty pharmacy. And even with that, they can have high copays. So setting patients up with copay assistance programs is vital to ensure that they have access to this medicine. This schematic here is quite complicated, but it just kind of shows how fragmented the system is to actually get started on a specialty medicine. So, with all of those kind of barriers to adherence um, and some solutions with them, I just want to kind of leave you guys with some medication rules. So, I want you to be honest with yourself. So, thinking through your own medicines, are we missing medicines intentionally or unintentionally? How well are you actually doing with your meds? We often think that we're doing better than we actually are. Once we start using pill boxes, we can kind of see how often we're actually missing medicines, but also be honest with your treatment team. They can help you come up with individualized approaches to help overcome some barriers you're having, especially if those barriers are surrounding like side effects or lack of benefit of your medicine. Next slide. So very quickly, just to wrap us up, I wanted to leave you with a quick assessment that you can kind of take with you, reflect on, and take with you to your next doctor's appointment. Um, are your medications working as you expect them to work? Are you experiencing any side effects of your medicine? How many doses have you missed in the past week, month, or several months? And finally, what caused you to miss these doses? So just think about this, take this with you to your next appointment. Um, And the last thing, just to kind of cover quickly, is promoting self management. So, I work in the pediatric population. So, our patients are diagnosed often when they're kids and their parents get all their education on their meds and their disease state. And then at some point, they need to kind of transition to the adult world and take care of their own medicines. Um, but I wanted to talk about it briefly today because you don't need to be a child or a teenager to have someone else help manage your medicines. We have lots of situations where adults rely on other people to help with their medicines as well. So kind of thinking about your own self-management, do you know your dose frequency of medicines, your allergies, why you take your medicines? You don't have to have this memorized, but you can keep that list or use some of those apps to help manage the medicines. Do you know the name of the pharmacy or how to refill your medicines? And then finally, if you have to give injections, do you know how to give them? If you were to have to give them yourself, and do you know important warnings related to your medicines? Individuals progress through the self management process at very different ages. So I want, to be to just share that those people who are managing the medicines for the patient can kind of help prepare them with tools to knowledge to succeed when they start to take over themselves. We start with kind of easier tasks first, such as filling pill boxes, and then eventually transition over to like filling meds from the pharmacy. That person should also provide distance support to the individual where we can check in every once in a while to make sure things are going okay, but then give hands-on support when needed, just to make sure that we're not kind of kicking the bird out of the nest, and that we're helping them through the process of transitioning on their own meds. And in summary, adherence to medications can help control pain, prevent progression of disease, and improve quality of life. There are many individualized techniques to help overcome non adherence. It's so, so important to be honest with yourself and your treatment team if you want to stop or change medicines. And promoting self management can help individuals successfully take over responsibility of their meds. Um, we went kind of right at our time limit, and I apologize for some of the technical issues, kind of took us over. So I don't know if we have time for questions, but I do have my email on our last slide if there are questions.
That's wonderful. Thank you, Dr. Wise. We really appreciate all the information. If anybody has questions, we can take a couple. I do see one already, which is interesting because you just kind of briefly touched on it. But this person has a rash, and we do hear this a lot with, hydroxychloroquine or really any medication. Is there anything that can be done about that?
Yeah. So, I mean, rashes can be challenging because it could be related to your medicine or it could be unrelated to your medicine. You're not burdening anyone by asking your provider about it. And I get that a lot where people are like, oh, I didn't think it was a big deal, so I didn't reach out. I would always reach out with any, symptoms you're experiencing. And that allows the team to kind of think about, when did your rash develop, to see if it might be related to a medicine. And then if obviously we could either consider changing that medicine or talk about treatments of the rash if we think it's related or not. But you're not burdening anyone by talking to your treatment team about those things.
Sure, sure. Okay. And we have somebody asking about, let's see, debilitating fatigue after Benlysta infusions. Is there anything to help with that?
Yeah, so it's also once again, kind of a specific question to that medicine, but I'll go back to kind of thinking through that the risk versus benefit of that medicine. So, I won't give specific recommendations because I don't necessarily know your case and what medicines you're on and everything else revolving around it. But, if that is truly debilitating, as mentioned, I think that's warrants that discussion on, is that side effect worth that medicine? Can we make any adjustments to how you get your Benlysta? Switching it possibly to the injectable form or something like that, that might reduce some of your side effects.
Okay. Let's go through, we'll give it two more. Do you think we'll ever have a breakthrough for a treatment to cure lupus?
Man, I wish, right? We are always hoping and hoping for that, and there's such great scientists and researchers searching for that cure. Right now we've made amazing advances within the past several kind of decades of research where we're having more targeted therapies, so we can only hope that we can continue to go that route. And all the medicines that we use are like specifically um, studied in lupus rather than things that we've just kind of stumbled upon that work, and really like reducing the treatment burden because unfortunately right now we're using so many medicines to try to control the lupus flares. So I sure hope that we have a cure sometime.
I know. And I know there's a lot in the pipeline coming up. And, if from a nonpartisan perspective, I would just say if that's important to you, lupus research is important to you, and getting a cause and a cure and finding it, just make sure you let your legislators know that that's really important to you. And you want to make sure that lupus stays on the forefront of our legislators' minds so that things are funded down the line so that we can find a cause and a cure. It's really, really important. So last question for you, and then I think you have some things going on in your world today. But this person wants to know if it's safe to take hydroxychloroquine during pregnancy.
Yeah, so that's a great question. Congratulations on that pregnancy, if that is an active pregnancy. But um, the rheumatologist will work very closely with you during a pregnancy to talk through which medicines are safe and unsafe. We're very lucky in the rheumatology world because we have guidelines that actually show us many of our medicines and what's safe and not safe in pregnancy. Hydroxychloroquine is a wonderful medicine in pregnancy. We recommend continuing that through pregnancy, and there's lots of data to show that it's safe. Some of our other medicines that we use in lupus are not safe in pregnancy. So, kind of working with the team on getting you off of those other medicines onto a treatment regimen that's safe throughout that pregnancy, and if there was any breastfeeding as well.
Really important point. Just make sure you're working with your physician to plan through pregnancy.
Hmm.
So that's very good advice. So thank you, Dr. Wise. We really appreciate your presentation and your time this morning, and hope you have a great day. Thanks so much.
Thank you very much. Have a good one.
You too. Okay, so we will move along. Our next presenter is Dr. Judith Lin. Dr. Lin is a practicing rheumatologist at The Ohio State University, where she serves as assistant professor of medicine and director of clinical trials for the Division of Rheumatology. She collaborates with nephrology and dermatology in the multidisciplinary clinic for patients with lupus and related skin diseases. She is the site principal investigator for several clinical trials in lupus at Ohio State University, Wexner Medical Center, and she will talk to us today about updates in lupus research. Dr. Lin, welcome. The virtual floor is now yours.
Thank you. What a great segue into updates in lupus research now that you've heard about kind of maximizing some of our current therapies, which are kind of limited in what we have and the toxicities. And I'm glad that people are interested in learning about lupus research. Next slide, please. And I have some disclosures. I am the site principal investigator for Ohio State University lupus studies sponsored by industry, but I do not personally receive financial support from them. And I received a clinical trials investigator award from the Lupus Clinical Investigators Network, which supports a small portion of my time in running the clinical trials. And as the director of clinical trials for OSU Rheumatology, I hope to increase awareness about the clinical trials and increase engagement from the community. Next slide, please. And so my goal today is to give you a general overview so that patients and caregivers can be informed on the general updates in lupus research, including the current hot topics and recent breakthroughs. And I will give an update on the pharmacologic therapies that are made available from the results of clinical trials, but I will not be giving treatment recommendations or endorsing specific treatments because they are very much dependent on each patient's unique situation and condition. And I will be talking about clinical trials, what they are and what's involved in a clinical trial and the process of getting a new treatment to the market. And lastly, some unmet needs in lupus research. Next slide, please. And research, there's many different types of research. Research is a systemic inquiry to make discoveries or expand knowledge in a specific field of study. There are many types of research, including basic science research, which allows us to understand disease mechanisms, the genes and immune pathways that are involved, which then allows us to identify drug targets to study. And then we have clinical research, which is studying these medications or diagnostic tests in humans to evaluate the safety and effectiveness of these therapeutics. And then we also have epidemiologic research to identify risk factors or comparing diseases amongst different populations. So today I'm mainly focusing on updates on clinical research, but that's very much dependent on the other types of research. And research in systemic lupus erythematosus is needed for a number of reasons. Lupus affects 200,000 people in the United States. It's a heterogeneous autoimmune disease that involves many inflammatory pathways, and our current treatments are often inadequate or associated with toxicities. And persistent lupus activities is associated with poor health outcomes, with cardiovascular disease being the leading cause of death in our lupus patients. And we also know that up to 50% of patients with lupus have some form of kidney disease, and many of them requiring dialysis or transplant. So we really hope to address these morbidities and improve their outcomes. We know that lupus has physical, mental, and social impacts that sometimes interfere with our patients being able to achieve their full potential. Next slide, please. And so our goals of research are to help us understand the genetic and immune pathways to find better drug targets with less toxicities. I'm sorry about the icons hiding some of the words there. And we want to personalize treatment so that we can provide precision medicine, meaning we want to give the right treatment for the right patient who would respond to that treatment, and know when to taper therapy. And we would like to be able to predict and reduce flares for patients who are at risk of those and address disease heterogeneities amongst different subpopulations. We also would like to address health disparities, as we know that lupus disproportionately affects certain minority groups with greater disease severity. And ultimately, we would like to improve outcomes and well-being for all of our patients. Next slide, please. And lupus may be caused by a combination of genes, environmental exposure, and immune dysregulation. And there's still new genetic associations being discovered. So the APOL1 gene discovered several years ago is found to be highly associated with kidney disease in patients of African descent. But more recently, we find that there's an X inactive specific transcript that's encoded on the X chromosome as a long non-coding RNA that's also involved in X chromosome inactivation in females, that this can induce toll-like receptor signaling that is an inflammatory pathway in lupus and is an important driver of autoimmune diseases in females. And there are other gene environmental interactions, as you can see in the picture here. Many of them play a role in for example, the female predominance of lupus, including hormones, particularly estrogen, which can function to promote some of the inflammatory signaling in lupus. And this is work reported by our division chair at OSU, Dr. Wal Jarjor, who studies lupus in mouse models. And he also reported that inhibiting certain microRNA that's associated with lupus may reduce inflammation in mouse models with lupus. And the gut microbiome is a hot topic in autoimmune diseases, including lupus. And the dysregulated intestinal flora is highly associated with kidney disease in lupus patients as well. And we also discovered a new immune cell type that is found in kidney biopsies of patients with lupus. So we are still trying to understand these different mechanisms involved in lupus to help inform better treatments. Next slide, please. And kidney disease from lupus has really been in the spotlight in the past couple of years because there's been much research and advancements in this area. And Dr. Brad Droven, who directs the division of nephrology here, is involved in many of the research in this field. And we found that targeting B cells, which are these immune cells that produce autoantibodies leading to inflammation, targeting this pathway in lupus is pretty effective for certain groups of patients. And a monoclonal antibody, belimumab, that targets the B cell growth factor has been shown to reduce the protein leak in the urine and preserve kidney function in patients with lupus nephritis when added to standard of care therapy. And a newer monoclonal antibody, obinutuzumab, which is even stronger depleter of B cells, this was just published last month and submitted to the FDA earlier this month, which is hopefully, it is expected to be approved for commercial use. So hopefully we'll have even more options for our patients. And we are also targeting these B cells by cell therapies, which I'll talk about later in the talk. And while calcineurin inhibitors have been used in different settings, we do have a newer generation of this called voclosporin that is also FDA approved for use in lupus nephritis, in addition to the standard of care therapy. So with all these new treatments being effective and available, we have updated guidelines from the American College of Rheumatology and the Kidney Disease Improving Global Outcomes Group just in the past year. But we are still trying to understand disease better by studying markers in the blood, in the urine, and particularly kidney tissue, which is very helpful in understanding some of the immune pathways involved. Next slide, please. We also find that because lupus is a heterogeneous disease, that there's not one treatment that works for all disease manifestations. So the skin is a common organ affected by lupus, and studying the skin lesions of lupus also help us understand the immune pathways and the potential targets for treatment. So one medication, anifrolumab, which binds to the type 1 interferon alpha receptor and prevents its signaling. This one is FDA approved, and clinically we're seeing that targeting this pathway is very effective for patients with inflammatory rashes. And then also targeting the plasmacytoid dendritic cells, which produces these interferons, as well as targeting the family of Janus kinase and tyrosine kinase 2 inhibitors, are also being studied in clinical trials with very promising results. And so we have a group of doctors here at Ohio State between rheumatology and dermatology who are seeing these patients and studying this field. Next slide, please. But while there are many ongoing studies in lupus, there are more medications that have failed in clinical trials. And there are many speculations as to why. We think that because lupus is a heterogeneous disease, that perhaps we should aim to recruit patients with more similar organ involvement and similar disease manifestations to really be able to see a response in those groups. And we may not be using adequate measures of response in the clinical trials. And so we would need better biomarkers to help inform the endpoints that we use in clinical trials. And we also see a high placebo response rate in the trials that placebo in most clinical trials these days are standard of care therapy. So while there's many kind of speculations as to why we see a high kind of placebo response, we do know that from prior studies, as you've heard from Dr. Weiss's talk, that there's a high rates of patients not taking their medications outside of the trials. So perhaps we can do better at educating and maximizing our current medications, and that might just be enough to make a difference for some patients. Next slide, please. So I've mentioned that medications are studied in clinical trials. So what is a clinical trial? It is a research study in humans to answer specific health questions. And most commonly that involves medications, but can also be other interventions or diagnostic tests or even observations with controlled variables. And we enroll patients or healthy volunteers depending on the study trial criteria. And there's a defined protocol which involves a schedule of tests and procedures to be followed for the study. And there are different designs of clinical trials, but many are comparing different treatment groups. So like the drug of study compared to the standard of care therapy. And often the trial endpoints are the improvement in disease activity scores. And results from the clinical trials are submitted to the FDA, and they use that information to make the decision on approving a drug to be marketed for commercial use, and hopefully to improve patient care. But even if the trials don't work out the way we hope it would still help us in our understanding of disease and inform future trials. Next slide, please. So the process of drug discovery to getting FDA approval and getting a drug on the market takes many years. And drug discovery starts from identifying certain targets stemming from our understanding of disease mechanisms, and then synthesizing those drugs that can be administered and tested in cells or cultures or animals in preclinical studies. Then with the results of these, the sponsor submits an investigational new drug application to the FDA, who then reviews everything for safety before moving forward to clinical trials in humans. And there are many different phases of clinical trials. So phase 1 trial is the shortest of the trials and requires the least amount of participants. And they may be patients or they may be healthy volunteers. And at this phase 1, medications may be tested at different doses. And about 70% of medications tested here are successful in moving on to phase 2 trial. And phase 2 trial gives researchers a clearer picture of the drug's effectiveness and its safety. And generally, one dose from the phase 1 trial is selected to be tested in phase 2. And oftentimes, there is a randomization to either getting the drug or standard of care therapy in these trials. So phase 2 trials may last several months to a year, and only about 33% of drugs move on to phase 3. And then phase 3 trial it takes 2, sometimes 3 years, and involves even more participants who are, again, getting randomized to either getting the medication in question or standard of care therapy. And we are able to gather more information on testing this in a larger kind of population. So about a quarter of the medication study here are successful in producing results that can then be submitted to the FDA for drug approval. And so the FDA will review the data and decide on whether or not it should come onto the market for use in clinical care in patients. And then after a drug comes onto the market, then there are real-world studies that are considered phase 4 trials, which are researchers gathering information on the medication in terms of more longer-term safety and the effects in subpopulations. Next slide, please. So the typical flow of clinical trial looks like this. It starts with the investigator of the trial identifying potential patients. They go through a checklist of inclusion and exclusion criteria. And then we do an informed consent process that ensures that the patient is aware of the details of the study and the potential risks and benefits. So there's a screening visit to make sure all the medications, labs, all the condition of the patient, they all look okay to move forward for trial enrollment. And then there may be a randomization depending on the trial design. And the investigator and patients are often blinded to the randomization, meaning that neither party knows whether the patient is receiving the drug being studied or if they're getting standard of care therapy. And this helps to avoid bias and to protect the integrity of the trial. And many trials may have an open label extension arm where even if the participant doesn't get the medication in question in the first part of the study, they would be able to enroll in get the drug in question in the open label extension arm. And then there's a schedule of activities about when to get the treatments, labs, and surveys during the trial. And the participant is able to withdraw at any point during the trial for any reason, such as if they've moved out of state, if they prefer alternative treatments, or if there are side effects. And most of the time, patients do well in clinical trials and have improvement in their disease. And then the data gathered in the trial process is collected and analyzed and reported and then submitted to the FDA. The next slide, please. So you might ask what the benefits and risks are for participating in clinical trials. So clinical trials allow participants to play an active role in their own health. You would gain access to new research treatments before they are widely available because, like I showed you, it may take a number of years before medication can be available for commercial use. And there are very strict rules governing the trial, so participants would be able to obtain expert medical care during the trial. They would receive compensation for their time, and they would help others by contributing to medical research. And there are some potential risks to trials, including some unexpected side effects, sometimes serious. The treatment in question may not be effective for the participant, and the protocol may be inconvenient and may require more time and attention than would a non-protocol treatment, including many visits, many study visits, treatments, blood draws, surveys. Next slide, please. And in order to foster a better collaboration of medical research in lupus, we have the Lupus Clinical Investigators Network, which is a network of leading medical research centers in North America, which Ohio State is a part of. And we hope to progress clinical trials forward faster for both the sponsors, investigators, and patients, and ensure that our trial participants receive the best overall care and lead the best studies to achieve the best outcomes. And so this network is overseen by Lupus Therapeutics, which is the clinical research affiliate of the Lupus Research Alliance. And next slide, please. So currently we're very active in sorry about kind of the formatting. We're very active in doing lupus research at Ohio State. We have basic and translational research involving animal studies. We have biospecimen repository and patient registries. And we have clinical trials looking at patients with systemic lupus, lupus nephritis, cutaneous lupus. And we have several open and actively enrolling systemic lupus trials listed here. And we are seeking patients with moderate to high disease activity who have failed at least one therapy. So if you are interested, please check with your current provider first to make sure they think it would be safe and appropriate for you to consider. And then you can contact us if you're interested in hearing more about these. Next slide, please. And somebody asked earlier about kind of a cure for lupus. So I think we are also moving towards that with a new type of therapy called chimeric antigen receptor T-cell therapy. It is first used in cancer patients and found to be effective for patients with B-cell lymphomas and leukemia to achieve remission. But it's a very intensely involved process where patients follow very strict protocols. So the patient's blood is collected and their T cells are selected out and engineered to express certain chimeric antigen receptors. So those receptors would then go and target and kill the B cells. And so this product is then given back to the patient. And we see that as this takes effect in the patient, there is less autoantibody production, there's less protein leak in the urine of patients with lupus nephritis, and less disease activity. This is studied in a handful of lupus patients, as well as a case series of patients with various autoimmune diseases that have reported significant improvement. And those patients who respond well to therapy, they're able to stay off their previous immunosuppressive regimen. So we think that we are moving towards a potential cure for lupus, but certainly we need more patients involved in these trials to be able to determine that. So I'm working with a company and we have one of the CAR T-cell trials open here at Ohio State University. But there are still many, next slide, please. But there are still many unmet needs in lupus and lupus research. So I will just point out a few here. So one is a study conducted by is a partnership between Lupus Foundation of America and Eli Lilly. And they looked at patient experiences, satisfaction, and expectations with regards to current lupus treatments. And patients reported a high level of burden with the current treatments. And the burden includes maybe inconvenient administration or access to the medications or toxicities of the treatments and the monitoring that's required for the current treatments. And they reported fatigue, joint stiffness, and pain are highly prevalent, and reducing those symptoms are top goals for our patients. But often there's a discrepancy between the patient and physician goals of treatment. So that same year, a group of researchers based in Duke University proposed a new categorization of lupus symptoms, which helps shed a new light on some of the symptoms and may explain why sometimes the symptom burden doesn't necessarily reflect disease activity in our patients. So they categorized symptoms into type 1, which are autoimmune inflammatory disease related that responds to immunosuppression, and type 2 symptoms, which are considered non-inflammatory as they're not directly related to autoimmune inflammation and do not respond to our immunosuppressive medications. And these symptoms are the fatigue, muscle and joint pain, cognitive dysfunction, mood symptoms, and brain fog that so often affects our lupus patients. So as there are no one reliable therapy for these type 2 symptoms, we need more research into this area. And we know that there are health disparities in lupus, as many minority groups have high level of disease activity, yet they have less access to care and are underrepresented in clinical trials. So we hope to better address this as well. So next slide, please. So I encourage you all to take part in lupus research, which can take many different forms. You can join our clinical trials or registry we have at Ohio State or other centers. And Lupus Foundation of America has a research accelerated by you registry that is dependent on the patient surveys. You can volunteer for patient engagement. So Lupus Therapeutics is looking for patients to join their patient advisory boards, their patient protocol review council, and their patient advocates for lupus studies, as well as community-based health equity initiatives. There are opportunities to become patient advocates for lupus studies through Lupus Clinical Trials Investigators Network, but also through advocacy events through the Lupus Foundation of America. And we hope that you may consider donating to lupus research, whether that's your time, your blood or tissue samples, or if you're able to donate money to help support lupus research. And all of this helps us move the field forward. I think that is the end of my talk. Thank you so much for your time. And I will, if there's any time for questions, I'll take some questions.
Thanks, Dr. Lin. Such great information. And, what you said on your last slide is just hits the nail on the head. We really need advocacy. We need people promoting research in the field. We need people, talking about how important it is to have research in the field. And of course, you want to make sure that you are participating in the clinical trials if you're at all possible or available to do so, because that's really important to advance the field. So we're getting closer, but we'll see what the future looks like. I do have a question that came in. Has the T-cell test shown elimination of the fatigue symptoms?
So that's a good question. There are not very direct evidence that the immunosuppressive treatments can help with a lot of what we consider the type 2 symptoms of lupus. However, if the fatigue or the symptoms are kind of in the setting of a lot of active inflammation, and if we control that better with these newer treatments, then we do see that patients have clinical improvement in those symptoms.
Okay, good to know. I know fatigue is something that really gets to pretty much most lupus patients, so across the board. So hope for the future. The one question that we're seeing a lot of CAR T questions. So do you envision CAR T being used for mild to moderate lupus in the future? I know it's more severe now, but.
Right. It's currently only being studied in patients with moderate to severe disease who have failed current treatments. So we don't know about mild disease. I would imagine it would be, but there are significant risks to the therapy as well. So currently it's only being used in patients who may Dr. Wise was talking about the kind of risk benefits of therapy. So currently it's only being used for the moderate to severe disease.
Okay. One more CAR T therapy question. Does it increase the risk of cancer?
That is a great question. We don't know. Certainly in the oncology world, there have been, of course, reports of recurrent cancer. In the autoimmune disease world, we don't have that long-term follow-up to know. We think there are some ways to modify that risk. For example, a lot of the CAR T cell requires a conditioning chemotherapy regimen in which that chemotherapy regimen is itself may be associated with increased risk of cancer. So designing trials that would eliminate the need for those chemotherapy conditioning regimen may alleviate some of that risk. But as to the actual CAR T product, whether that may contribute to future risk of cancer, it remains to be seen.
Yeah, I think it's always risk versus reward and what you're getting out of it at the time versus long term. So it'll be interesting to see that with this promising therapy. Last question I'm getting for you. Have you heard of any studies about the treatment of lupus and cardiovascular disease?
So there are more studies on the kind of, we call cardio-inflammatory disease in lupus. Currently, there's not specific treatments for that, but we are finding newer biomarkers that can be used in patients with not just lupus, but other rheumatic diseases that also have increased cardiovascular risk, for example, psoriasis, psoriatic arthritis, and rheumatoid arthritis. So we're kind of partnering with other research groups in looking at these kind of cardio-inflammatory diseases.
Okay, perfect. All right, Dr. Lin, thank you so much. We appreciate your time today and all the great information, and just really appreciate you helping us out today. So thank you so much.
It's my pleasure being here. Thank you.
You're welcome. Okay, we're going to move along to our next presenter. This is Dr. Yasaman Ahmadzadeh. And Dr. Ahmadzadeh will be speaking today about the musculoskeletal system in pain management. She is a current rheumatology fellow at The Ohio State University. She earned a doctorate of medicine at Istanbul University and completed a residency at Roger Williams Medical Center in Rhode Island. Welcome, Dr. Ahmadzadeh. The virtual floor is now yours.
Thank you so much for the introduction. It's a pleasure to be here. So as you mentioned, we're going to talk about the pain in lupus patients, which is a very complicated and serious issue. So we're going to dive into this topic today that we know it nearly affects everyone with lupus. And the particular pain is usually in muscles, bones, joints, and that is what we call the musculoskeletal pain, also briefly known as MSK system. By the end of this talk, we can actually move to the next slide. Thank you. By the end of this talk, we will be able to have a better understanding of some different things, including the different kind of the pain in the lupus, which can be the inflammatory pain, the neuropathic pain, the centralized pain. We will also be able to differentiate the pain from different kind of like the MSK system, and also we will be able to have a better understanding about the nervous system pain that can cause the chronic pain in lupus patients. We will also briefly talk about the medical and non-medical pain management strategies in lupus patients. So we can move to the next slide, please. So talking about the MSK system, as I earlier mentioned, MSK system includes bones, joints, muscles, tendons, and ligaments, and cartilages, and they're all working together to support our body and help us move. A brief explanation of each of them. So bones provide the structures and protects our organs. We can think of them as a framework of our body, and joints are where the bones meet each other and they allow us to bend, stretch, and move with flexibility. Muscles are organs that help us move and also provide stability, whereas tendons connects muscle to bones, and cartilages, ligaments connects bones to bones. And cartilages are like we can think of a cushion, like jelly-like, or tissues that kind of provide flexibility between joints, and they absorb like shocks during the movements and kind of protect the joints during the movements. And when we are talking about lupus pain, obviously any of these organs can be affected during lupus because of inflammation, and can cause pain. So as we can see, there are like not only one but different organs that can be the cause of the pain in lupus. Can move to the next slide, please. So talking about different causes of the pain in lupus, we have inflammatory pain, which is like the most common maybe pain we can describe in lupus, and it happens when our body in the setting of autoimmunity affects our own body, affects our own tissues and cause inflammation. This can be in the joints, which can cause the arthritis, kind of like a pain, or it can cause inflammation in muscles, which can be myositis, or also inflammation in tendons, which can be explained as tendonitis. And this kind of chronic inflammation throughout the years can cause erosions if obviously the lupus is not very well controlled, can cause erosions in the joints. And sometimes because of this severe inflammation, the blood supply can be narrowed and can cause avascular necrosis. Basically, that means that the blood is not getting to the joints and there is like no enough blood supply and the joints kind of like become ischemic and they become necrotic. And also osteoporosis is another kind of the pain that can also be a complication of severe and chronic inflammation. Another kind of the pain that we want to talk about today is a pain called neuropathic pain. It is a nerve-related pain. Usually it feels like burning, tingling, and numbness. And usually patients feel that pain in their extremities, especially feet and hands. So any kind of like new burning and tingling pain can be neuropathic pain, which a little later we will talk about like why this pain can happen in lupus patients. And finally, we will have a pain cold, which is very common also, a fibromyalgia-like pain, which is a central nervous system kind of like oversensitization pain, and patients are just like more prone to feel any kind of pain because of an oversensitive central nervous system. We move to the next slide, please. So now let's take a moment and talk about what you as patient often share about living with lupus. First, usually like you might come in and have like this unpredictable pain that can happen in any of the joints. They can move from one joint to another. They don't really like, they don't need to follow a very like specific pattern. They're usually long-standing, even sometimes when your lupus is under control and quiet. And this kind of pain affects your daily life. It can affect your ability to work, take care of your family, your social life, and basically your whole life. So it's, as we assume, it's very difficult to deal with. And importantly, there is a real need for better care, and many patients want a better and more personalized pain management. Move to the next slide, please. So now let's talk about some of the exciting advances and how scientists, can we go to the next slide, please? Yeah, so there's some like good news about how we have some better understanding of the lupus-related pain. So recent research shows that in lupus, the nerve cells that affect pain, called nociceptive neurons, are more active than normal. And this means your nervous system may report more strongly, and they will report the pain signals more strongly to the central nervous system. And in this scenario, you just like feel the pain stronger than any like regular person, basically without lupus. And brain and spinal cord connections involved in pain are also affected, leading to more intense pain response. And we also know that some of the inflammatory proteins like TNF-alpha and interleukin-1 beta and changes in early regulation in a system called AMPK activity may worsen chronic pain. So basically, with any activity, also like with this like activation of these proteins, you will feel the pain like more strongly. And on the top of that, we basically just have harder time to treat this pain because of this like very complicated different systems, as you can see. Can we move to the next slide, please? Okay, and it's very important to remember that there are also non-autoimmune causes of musculoskeletal pain. We earlier talked about the autoimmunity and lupus-related pain, but also there are other causes of pain, such as mechanical factors, which can happen with overuse injury and poor posture. And this is a pain that usually it's how we can usually differentiate it from the lupus and autoimmune pain is like when you feel pain usually like end of the day with like more activity, whereas lupus pain is like more, in the morning with like resting and more like stiffness. We also have degenerative condition, which osteoarthritis is one of the very common well-known diseases in this situation. And also sometimes metabolic disorders such as vitamin D deficiencies can cause the bones to be more weak and soft and increase the pain in the bones. There are obviously other causes such as infectious causes that can cause pain, and as we mentioned earlier, neuropathic and nociceptive pain is also a pain in lupus patients, and a good example for neuropathy pain is like the patients with diabetes who have burning and tinglings in their extremities, or a good example of nociceptive pain is a sprained ankle, and where you feel this pain long time after an injury that has happened to any of the joints. It can be sharp and throbbing pain from a tissue injury. Next slide, please. Okay, so now we should talk about like what are some adverse, some of the different kind of like characteristic of this pain. So as we just briefly mentioned, in inflammatory pain, you will often see symmetrical joint involvement, like both wrists, both knees, whereas in non-inflammatory pain, it's usually localized to only one joint and is asymmetrical. The morning stiffness is more specific to inflammatory pain, and usually when patients like describe a stiffness more than 30 minutes, that tells us that this might be an inflammation-related pain. Whereas in non-inflammatory pain, the stiffness is like way briefer. The inflammatory pain also comes with some other systemic symptoms such as fatigue, fever, whereas non-inflammatory pain usually do not have these other symptoms. And one good lab result that we can look into are some inflammation markers that can be high in inflammatory pain, such as ESR and CRP, and I'm sure many of you are familiar with, whereas this lab work can be normal in non-inflammatory pain sources. But it is very important to know that these are not obviously very definitive. For example, patients with fibromyalgia often report prolonged stiffness all day that can mimic the inflammatory pain. As we said, it's usually like more prolonged stiffness. And the ESR and CRP, even though are some good resources for us to kind of like investigate the cause of the pain and the autoimmunity related to that, but it can also be high in other conditions such as metabolic disorders, obesity, infections. So it's very important to correlate this with the clinical picture and other symptoms. Can we move to the next slide, please? So this is also a very important slide I want to briefly talk about. It's called, I'm sure many of you are familiar with the fibromyalgia, and the kind of like a big umbrella term for that is central sensitization syndrome. And this refers to an increased sensitivity of the central nervous system to pain stimuli, leading to heightened pain perception. This phenomenon is considered a key pathogenic mechanism in disorders like fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, and temporomandibular disorders. The symptoms of central sensitization syndromes include widespread pain, heightened sensitivity to touch, so anything can be painful. Even sometimes patient reports like, wearing their clothes can, cause pain in their skin, and fatigue. And obviously, as we can see in lupus patient, CCS can manifest as pain extending beyond the affected joints, increased sensitivity to touch and pressure, fatigue, sleep disturbances, and cognitive issues, which we also call brain fog. Can we move to the next slide, please? So these are some of the new images that we can use, and as we just like briefly talk about how you feel it, the pain, we have some tools to kind of see the pain in the patients. So obviously always the first line is x-rays, but we have been also using some new imaging such as MRIs and ultrasound, not new to the medical world obviously, but like in lupus patients, we've been using them more frequent than like other patients to see the early inflammation in the patients, because sometimes x-rays can miss some of the soft tissue swellings and other joint inflammation that these images can be able to tell us if there is any inflammation. But again, it's important to know that imaging is not always needed, and it's very depends to the doctor opinion to see if this is needed or not, because not every joint pain requires an imaging. But again, ultrasound and MRIs are two tools that we frequently use to kind of see if the pains are inflammatory or not. We move to the next slide, please. So now let's talk about the management of lupus-related pain, starting with the medication. These are some of the common medications you can see, and I'm sure you are familiar with most of them. The first one is NSAIDs, also the ones that are like multiple kinds of NSAIDs that I'm sure you know of, like ibuprofen, but the ones that we more frequently in lupus patients are those like diclofenac, meloxicam, celecoxib, that they help to reduce inflammation and joint pain. The other very common medication we use in lupus patients are corticosteroids, and the very common one is prednisone that we use for flares, but we usually use them very cautiously because they have very side effects that we will in the next slide we will learn about some of them. And also immunosuppressant and biologics are very common tools and medications we use in lupus patients, that they kind of control the underlying immune activity driving the inflammation. And there are some pain relievers such as Tylenol or acetaminophen or duloxetine that we use for pain management in lupus patients. And obviously some over-the-counter or like prescribed medications such as like topical agents like lidocaine patches or capsaicin creams that can be used for like some more topical coverage of the pain. Can we move to the next slide, please? So this is a slide that I just talked about, that we kind of go through over some of the side effects of the pain, and while a pain medication can be helpful, they each come with potential side effects we need to keep in mind. NSAIDs like ibuprofen and diclofenac can increase the risk of stomach ulcers, bleeding, kidney problems, and heart issues. So they should be avoided in people who have peptic ulcer disease, in people who have chronic kidney disease, in those who have some malignancies, because they can also increase the risk of bleeding in some certain malignancies. Steroids like prednisone are effective for flares, and we commonly use them for the flares, but it's very important to note that they increase the risk of osteoporosis, they can cause weight gain, they can increase the high blood sugar, so not a very obviously good option for patients with diabetes, and they can also increase the infection risk. So we are more cautious, and we try to use other steroid-sparing agents and kind of like limit the use of steroids and taper them accordingly due to the side effects. The other medication that we earlier talked about are the immunosuppressants that can affect the liver's bone marrow immune system. So for that reason, we usually monitor blood work every 3 to 4 months for patients who are on these medications, such as methotrexate, azathioprine, mycophenolate, mofetil. So that's one reason that we want to make sure the liver and kidneys and all other like organs are under control, and we do check them quite frequently, and we try to avoid them in pregnancy. Most of these medications are not safe during the pregnancy, so it's very important to let your doctor know that if you're planning to become pregnant, or if you're pregnant, to kind of like make sure that this medication is either like discontinued or changed to a safer option before you are pregnant. The other medications that we use are the infusions such as rituximab, belimumab, or TNF inhibitors, and these medications are also known to increase the risk of TB or hepatitis B. So we always check for these infectious workup prior to starting the medications, and we annually recheck them to make sure that there is no reactivation of the TB or hepatitis on the patients who are on these medications. And as we earlier mentioned, there are like some pain relievers that patient can be on besides of this other medications, such as acetaminophen or Tylenol, which you can also find over the counter. which is known to increase the, if on high doses, can increase the risk of hepatotoxicity, which is basically means liver poisoning. So we want to make sure that, you're not on a very high dose, or if you have any history of liver cirrhosis or like liver diseases, you want to make sure that, you let your doctor know that, this is kind of like monitored more frequently. And some of the pain relievers, such as duloxetine or gabapentin, can also cause drowsiness, dizziness, and swelling. And obviously, as you all know, opioids can increase the risk of dependence, constipation, and respiratory depression. So again, not a very preferable option for us to use. Move to the next slide, please. So we did talk about some pharmacologic causes of pain management, and these are some non-pharmacologic strategies that we do recommend, and they are as important as pharmacologic strategies. The first one, as we can see here, is physical therapy and exercise, that they can improve the flexibility and strengthen the muscle around the joints. So in the long term, they can actually be very helpful. The other very important option is actually, and there are data that has shown that this has really helped patients with all kind of like autoimmune diseases, as the anti-inflammatory diets which are high in omega-3, whole foods, and low in processed food can actually help to kind of decrease the the overall inflammation in the body and help with this pain. The other option that can help the patients is stress reduction techniques such as meditation, yoga, breathing exercises, as well as sleep hygiene. So a good sleep will always help with improving the pain tolerance. And we have seen patients who do report improvement with some strategies such as acupuncture and massages that helps with the pain. We can move to the next slide, please. So I just wanted to give you some examples of some exercises that can actually help with strengthening your muscles and help with the pain. So on the next slide, we can see the standing leg lift. So as you can see here, you can just like all these exercises you don't need any equipment, so you can do them at home. On the first one, you can just stand tall, hold onto a chair for balance, and slowly lift one leg out on the side and then bring it back down, and repeat this like 10 times on one side and then move to the other side. On the second exercise, we see sit and stand. This helps build leg and core strength. So you can start on a chair, try to have your arms crossed and not use any support from your arms, and stand up slowly and then sit back down slowly. And this exercise improves mobility and balance for daily activities as well. On the next slide, we can see kickbacks, which helps us to strengthen the glutes and hamstrings. On this one, you can just stand tall, hold onto a chair for support, and gently kick one leg back up, and then bring it down and try the other side. On the fourth exercise, we have the clam exercising. So here you can basically lay on your side and have your knees kind of like attached to each other, and try to open one knee and kind of like a clamshell and lower it back down. This targets hip muscles and support walking and balance. And on the next slide, we have the quadriceps stretch, which can help the front of the thigh and quadriceps if you lie on your stomach and bend on knee and gently pull your foot toward yourself, and then hold on a few seconds and then switch to the other side. And the last exercise here, we have the hamstring stretch. This is stretch focus on back of the thighs and hamstrings. Lie on your back and gently pull it toward yourself while keeping the other leg flat, and then switch legs. And there are so many more of these exercises on the internet that you can use and kind of strengthen your muscles. And I thought these are some of the main ones worth talking about. Can move to the next slide. So now that we kind of like went over the kinds of pain and kind of like the way that we can manage the pain, it's also important to know when you want to seek the medical attention when you have this kind of new pains. So always know that if you're experiencing any severe joint pain, any redness, any warmth, this might always be a signal of flare, and you want to let your provider know that you are experiencing this kind of like new pain. Any new nerve pain, and that is basically burning, numbness, tingling, can be a sign of new neuropathic pain. So you want to make sure you let your provider know again about this. Any persistent fatigue, brain fog, weakness might be something beyond routine lupus, and can also be, as we earlier mentioned, signs of fibromyalgia. So it's always good to let your rheumatologist and a primary care doctor know about these symptoms as well. And any sudden bone pain, fractures, which can be related to steroid-induced osteoporosis, if you've been especially on steroid for a long time, is also worth very important to let your provider know about this. We can move to the next slide. So managing lupus pain often takes more than just one doctor, and I'm sure many of you know already about this. Pain can come from many different sources, as we earlier talked about, and so many different teams may help you to kind of manage this pain. And how different providers can help you, as well as here, is like, obviously your rheumatologist usually focuses on controlling your lupus inflammation and the autoimmune kind of pattern of the pain. But also we do refer many of our patients to pain specialists to help with the chronic pain and any new nerve pain with medications and different procedures. Our physical therapists are very helpful in this setting to work with you to improve your strength and mobility throughout the disease and kind of help with the movement. We do refer patients to occupational therapists to help with daily activities and modifications and joint protections. We also do refer patients to neurologists for some other workups, such as like EMGs, especially if there is any new kind of like nerve-related pain that we think is like, tingling, numbness that is related to neuropathies. And also psychologists and pain therapists can support mental health and teaches coping strategies like CBDs to kind of like cope with the pain. And obviously, we're always like in touch with the primary care physicians to oversee general health and non-rheumatologic pain causes. We can move to the next slide. So these are like some of the takeaways points for today's talk, and just want everyone to know that lupus pain is a complex pain, but thankfully with new researches we are getting more understanding of different ways to manage the pain. As we just talked, pain is not always coming from the active inflammation, nerves, spinal cord, and like a general nervous system can have a big role on the pain. That's why we do recommend a multimodal approach, combining physical therapy, exercise, nutrition, sleep, and medication that can kind of help to manage the pain better. And there are some future treatments that may be more targeted and effective for the pain. So there are still like so many studies on this, and yeah, this is the end of my talk today. I'll be happy to answer any questions.
Thank you so much, Dr. Ahmadzadeh. A lot of great information. Pain is very much a hot topic for lupus patients, as you know. I am getting a very popular question because it's getting a lot of thumbs up here, asking about the use of CBD cream for pain.
Yeah, we do not prescribe them in our offices, but we do have patients who are using them and are actually happy with them. So it's one of the maybe conservative ways to manage the pain, and we are not against them per se, but again, it's not something that we do prescribe routinely in our office. One thing that worth mentioning is actually, and there is data on that, as turmeric that has helped to has shown to help with some of the inflammation, and it's something that it's a spice that can be find easily on markets, and quite like less of harm. So yeah.
Okay. And would so I have heard that about turmeric before, and I do know patients that maybe take it as a oral supplement, but also topically. Is there one that's recommended over the other?
Usually it's something that we do recommend to be consumed with diet, because it is known to be absorbed better with fat. So if you can mix it with your milk, even though like there are supplements, but the best way to absorb it is through diet. So through like, and it is absorbed with fat. So if you can add it to your food, or like, add it to your like daily coffee or milk, or that is the best way for the best absorption.
Okay. Thank you. And I do want to ask real quick, somebody is also kind of pulling in the CBD gummies. Is that sort of the same answer as the cream?
Honestly, I have no information on the gummies.
Okay. So not sure if the patients are taking that right now. Okay. That sounds good. One last question here for you. Somebody is saying that their doctor would like to try Botox off label for their joint and muscle pain. Is that something you've heard of before?
We do, especially, we do use that in rheumatologic clinics. Some providers do use Botox for pain relief. It is helpful, but it's something that needs a repetition. So it's like steroid, how, every 3-4 months you probably need like another injection. Botox is also something that is not permanent. It's not a cure, but it can help with some of the musculoskeletal pain. So I have seen patients who have reported like some relief from Botox, but again, not a cure for lupus pain.
Okay, great. All right. We really appreciate your time today. Thank you, Dr. Ahmadzadeh. Great information. And if we have any questions that come after this, we'll let you know. Thank you.
My pleasure.
You're welcome.
Okay. All right. We're on to our last presentation today, Dr. Elidona Mirashi. I would like to say we might run about 5 minutes over. I hope you stick with us, but we're going to try to get through this. So Dr. Mirashi is a dedicated physician with a passion for patient care. She earned her medical degree from Università di Torino, Italy, and completed her internship at One Brooklyn Health in New York City and her residency at NYMC, Landmark Medical Center in Rhode Island. Currently, she is a second-year fellow at OSU, where she continues to advance her expertise in patient-centered medicine. She has also conducted research at Columbia University, contributing to advancement in the field. Dr. Mirashi will present Reducing Flares in Lupus. Dr. Mirashi, the virtual floor is now yours.
Okay, thank you so much for this introduction. I'm very happy to be part of this talk and be able to provide some more information for our patients. So I'll be talking about how to reduce flares in lupus, which is very important, and how to manage. A lot of our patients, when they come to us, they want to know what else besides medicines they can do to help their disease and prevent the flares. Next slide. Okay, so I will not talk long because the symptoms, it was already talked. However, we divide into big groups, which is one, inflammatory symptoms and then non-inflammatory symptoms. Inflammatory ones are fever, chills, skin rashes, joint, muscle discomfort. There is also this difficulty breathing, especially when taking deep breaths, and this is because the inflammation is on the lining of the lungs, swollen lymph nodes, swelling in arms, legs, face, mouth sores and ulcers, as well as nose sores and ulcers. I just want to mention that a lot of times a patient might not be aware about these mouth sores because they are not painful. Obviously, you also have the other group of patients which tell you, okay, I have painful sores, but that is also a way how you can say that lupus can flare. And these sores are found in the on the roof of the mouth or inside the cheeks. Next slide. Non-inflammatory symptoms is pretty much what Dr. Ahmadzadeh talked about: fatigue, widespread pain, fibromyalgia. Then we also have mood disturbances, irritability, anxiety, depression, and cognitive dysfunction, which are part of unfortunately, of lupus patients and the flares. The common triggers, I feel like once you know your disease, once you know what triggers, what makes it worse, then you are able to adjust your lifestyle based on that. And the most common triggers are high stress levels, lack of quality sleep, too much sun exposure, infection, sickness, lack of exercise, medication, as we already talked, and then diet. And we're going to talk for each one of them in detail. So talking about stress, which is big part, I guess, of everybody's life, how our body reacts to it. There are two ways how the stress impacts our body. There is the acute stress and the chronic stress. In acute one, it's our body, when you find yourself like in front of abrupt stress, something that was unexpected, it produces and releases hormones like cortisol, adrenaline, and noradrenaline. And as I mentioned, if it's like acutely, it helps boost the immune system and helps you like handle this challenge and take like a decision of that. But when the stress is chronic and comes, it's every day for a very long time period, it does not help your body anymore. At that point, it makes it weak and make the body more vulnerable to illness and obviously to flares of lupus. The next one. I have divided like in some categories how different types of stress. There is emotional stress, anxiety, depression, grief, major life changes. And as we know, all of those do take a long time. They are chronic, so they tend to weaken the immune system and contribute to the flares. Physical stress, overexertion. While it's important to exert, you also don't want to overdo it because every strenuous activity puts your body into strain and triggers the symptoms. Infections, viral, bacterial infections, cold, flu, COVID, other infections that we're going to talk later about as well. All of these overstimulate the immune system and leads to flare. Hormonal changes. And I want to take a little bit more time here because as we know, lupus, unfortunately, it's more frequent in the females than males. And the majority of our patients are kind of in childbearing age, so pretty young. And every change of the hormones might affect and impact the lupus activity. Even the monthly menstrual cycle, it might a few days before patients might start to feel some of the symptoms. Obviously, they do not last long. And a lot of times they are not even, they don't pay attention because they think it's just regular with their period. However, the big change of the hormones that happens either in menopause or in pregnancy, they do affect mostly. And in pregnancy, it's important, and I cannot stress this enough, that if you are this young girl that has lupus and wants to start a family, you have to sit down and discuss with your doctor. Because if you get pregnant while your lupus is not very well controlled, you're going to have there are many studies and it's proven that lupus does cause it does flare in pregnancy in about 60%, and depending on which trimester you get the flare, sometimes it might be life-threatening for both the baby and the mom. So as in rheumatology, really wants our patient to not have any flare for at least 6 months to a year before they decide to get pregnant or start their family. So please sit down, discuss with your doctor way before when you are just thinking to start a family, and make sure that your lupus is very well controlled. Medication-related stress, obviously, we discussed this many times today, side effects and the interaction sometimes between treatment, or some patients just don't like to take medications and they might skip some doses and so on. All of these creates a stress on your body. Surgeries, injuries, physical trauma, everything that stresses the body obviously makes lupus to flare and get worse. Okay, next. How do we manage stress? And this is very important. There's different ways what you can do. Obviously, some works better for some patient, others works better for somebody else. But practice mindfulness, meditation, engage in yoga, deep breathing exercises, prioritize the rest and relaxation. And if stress is overwhelming, talking to a counselor, to a therapist, or somebody really helps. Meditation, obviously, it helps by reducing the heart rate, taking deeper breaths. This ensures a better oxygenation of the brain, which helps relax the central nervous system. And at the same time, the cortisol level, which we said it really affects it, it goes down. And there is a study done actually in 2003, which was the largest that I found. And they used a cohort of patients, 650 patients, and they followed them over 2 years. They did check, their stress level, the fatigue, depression, anxiety. They divided in 2 groups. One of them did something, whatever it was better for them, like, I don't know, somebody yoga, somebody meditation, and so on. And they kept checking with surveys. And they saw that by the end of the 2 years, the group that did something about the stress, it was significantly better and significantly better quality of life and low lupus flares. Okay, next. Here, I just brought 2 small studies that are a little bit more recent than the previous one. One is done in Iran and the other done in Israel, 2017 and 2021. And they followed these patients for 8 to 10 weeks. They, like the one in Iran, they used mindfulness behavior, and the other one used mostly like a stress-based reduction. They used these surveys, followed with the patient for an hour, sat down, talked to them for an hour weekly, and then they saw that by the end of this, there was better quality of life and less flares. However, it was interesting how the first study, the one in Iran, did not show much improvement of the symptoms on the patient, but it did show that the quality of life was better. So even, I guess I just want to bring this up, that even if you feel it's not working, you feel like you are not seeing those results, persistence should be the key, and you still should be able to see some improvement in the long term. Okay, next. Rest, it's very important. As we already mentioned, that fatigue is one of the most common symptoms, and almost 80% of patients do have fatigue. So a proper rest, good night's sleep, it's very important to manage the exhaustion. Taking breaks during the day as well. I know it's not possible for everybody, as somebody is working and doing things. However, if you are able to sleep good at night and take those breaks, keep this routine. It's very important to keep the same routine, because this brings also helps stabilize your symptoms. And while the lack of sleep triggers the inflammatory cytokines and worsen the lupus symptoms, when you rest, you allow your body to repair tissues and allow your immune system to regulate. So I'm pretty sure it's hard to get a beauty sleep, but you can try to do your best. Okay, next. Now, very hot topic, diet. All my patients wants to know about diet, and I feel like it's an important part of managing the disease and the inflammation. So, anti-inflammatory diet consists on eating more fruits, veggies, whole grains, lean proteins, omega-3, limit processed food, refined sugars, and stay hydrated. And now we will talk on the next slide what type of food you should eat. So we have the best food to eat to reduce the lupus flares are berries, like in the family of fruits, berries, blueberries, strawberries, oranges, apples, because they all contain antioxidants, flavonoids, and the vitamin C who help like reduce inflammation. In the veggies, spinach, kale, broccoli, carrot, sweet potato contains other vitamins that help strengthen the immune system. I just want to mention very quickly, do not overdo it with spinach and kale, because then sometimes when my patients come, those that are very dedicated to keep the diet, they come and we do blood work, and then the potassium is kind of on the higher side. So eat, but not overdo it. Healthy fats, avocados, olive oil, flaxseed, walnuts, they all have this omega-3, which is absolutely important to reduce inflammation. And I'll talk a little bit more. Lean proteins like salmon, tofu, beans, poultry reduce as well, whole grains, and dairy. Dairy, it's great. It reduces inflammation, but sometimes it's hard to understand, because when patients start eating dairy, yogurt, almond milk, feta cheese, and like other products of this family, they start feeling worse. And the reason is that they don't know they are dairy sensitive. So if you know you're dairy sensitive, obviously you eliminate and you don't take them in excess. But if you do not know, I always recommend to start eating a little bit and then manage or monitor your symptoms. Herbs and spices, as Dr. Ahmadzadeh mentioned, turmeric, ginger, garlic, and cinnamon. Plenty of studies that have shown that these are natural anti-inflammatory properties. And yes, like the powder, eating with your food is much better than the supplements. There was like 1 or 2 studies that they show that maybe taking all these in supplements might be might be actually hurtful for the liver. Obviously not everybody, but whoever has liver disease. So we recommend the powder, ginger, everything that is like amazing, that family. Hydration, water, green tea, herbal teas, all of those should be very good, flushing out the toxins. Next. Okay, so just quickly, this study, Clark et al. Was amazing on addressing also all the vitamins. And while we all know that all the vitamins are very important for our system, autoimmune and also functioning, there are some of them that this study showed strong evidence that are the most important one. Vitamin D, levoflavones, fibers, omega-3. And then obviously vitamin E, A, B, C, and calcium and the others. You can either take it with your multivitamins daily, or you can eat food that contains the most. But what I want to emphasize here is like vitamin D. It's very important. There was this study with about 117 patients, all like with lupus, and they went and checked the vitamin D, and it was very low in all of them. And it's important. There is not yet a consensus of how much vitamin D a patient with lupus should take. So we recommend just to keep a normal level, and making sure checking continuously, like every 3 to 6 months, every 6 months, I would say, your vitamin D, and making sure that it's normal levels. Okay, next slide. Okay, the omega-3, why it's important, can be found in fish oil, flaxseed oil. And it's important because reduces your cholesterol, the bad cholesterol, increases good cholesterol, reduces triglycerides. And we all know that lupus, on the long run, after 5 to 10 years, has these patients have a higher risk for cardiovascular disease. So if you start taking fish oil since the beginning of your disease, you are helping yourself by reducing at least one of the risk factors for developing cardiovascular. Then the flaxseed oil was seen to be more specific, I guess, for lupus because reduce the creatinine in lupus nephritis, and then reduces this anticardiolipin and beta-2 glycoprotein, which in some patients that have lupus and also have antiphospholipid syndrome, they're at higher risk for developing blood clots. So this is another one good like to introduce in your diet. Okay, next. So now let's talk about foods that are bad for lupus, what you should avoid. Processed food, of course, packaged snacks, frozen meals, fast foods, they all contain this like preservatives and additives who increase the inflammation. Red meats, beef, pork, promote inflammation. Again, we don't say never eat this food, but try to limit as much as possible. Dairy in excess that we talked about, all the refined sugars and grains, gluten, salt is another very important part that we tell our patients to reduce, not get a lot of salts because it might trigger the inflammation and at the same time increase the high blood pressure and affect your kidney. So just the minimum amount of salt to make your food tasty. Alcohol, caffeine, all of that also promotes inflammation. There are some oils as well that I feel we should talk about, like omega-6 heavy oils. Vegetable, sunflower, margarine, all of these promote inflammation as well. So try to use a healthy oils. And the alpha sprouts. There is plenty of studies that have shown that they contain this L-carnitine and triggers lupus flare. But I also want to mention about these nightshade veggies, because some of my patients had brought this up, and then I looked actually about it. Tomatoes, potatoes, eggplants, and peppers. In some specific patients, we don't know why, they promote the inflammation. Some others do just fine. So once you are aware, then you are able to determine what those kind of veggies do for you. Okay, and then if you have any symptoms, then obviously start to cut down. Okay, next one. Okay, this I like this slide a lot. It might be complicated, but it kind of tells everything that we talked about. And one is that lupus has a genetic predisposition, but what is important is that the environmental factors and your lifestyle contributes to not even developing lupus, but also flaring. And as we already mentioned, female are more affected. Obesity, high-fat diet, they all have this high adipokines, which cause an imbalance of the immune system, and by causing that, they increase like the flares. Then low vitamin D, as we mentioned, and we talked. I want to talk about dysbiosis. Dr. Lin mentioned a little bit that there are studies going on, and dysbiosis, it means that our gut and our body has good bacteria and bad bacteria, but they live together and then they interact with each other. Now, if something happens to our immune system, this living together gets interrupted, and that's when dysbiosis happens. And in lupus, there were plenty of studies, but there was a specific study done where they got like 117 stool samples in patients with untreated lupus, and they found bacteria that they were not supposed to be there. And it's suggesting that there is a leaky gut. So a leaky gut, it means when this good and bad bacteria, as we said, they do not live well together anymore because something happens in the immune system. They leak out toxins, pathogens, and they can go in different organs, and they can go like activating the immune system. And this is very, very important. So try as much as possible to have like a healthy lifestyle. And eat healthy and maintain this your immune system with whatever you can do based on those. Okay, next slide. Lifestyle factors. This reduce alcohol, because it is already shown that can increase the risk of lupus. Cigarette smoking, I'm not going to go in detail here, but this, you can see here how many cytokines and how many different paths that can activate the lupus. Sun, ultraviolet, and also all the caffeine beverages. All of them, if you take everything in excess, absolutely they can cause flares of the lupus. So try to work on these sides to manage whatever works for you. Like if you're smoking, whatever works, try to cut down. Okay, next one. Protect yourself from the sun. It's important. And actually, this was also one of the reasons why lupus patients were found to have low vitamin D, because we ask them and recommend to avoid sun as much as possible, because it can activate lupus in the skin, but try to wear sunscreen at least 50 or higher. And obviously, whenever it's possible, wear long sleeves or seek for shades, as well as try to avoid that direct sunlight between 10 a.m. and 4 p.m., which are the strongest. Okay, next. Now let's talk about infection in lupus. If you can go back to the other slide, one more. Okay, the infections are the most common infections are respiratory infection like pneumonia, bronchitis, sinus infection, urinary infections, as well skin, sometimes Mirashi, sores or cuts. Because lupus, lupus patients don't have a very good immune system. They might tend to get infected more easily. Shingles, herpes, they are very, very common as well. And then sepsis, especially severe life-threatening infection that is in your bloodstream. Next one. So how you prevent and what you have to do is stay up to date with all the vaccinations, and we'll talk about that. Hand hygiene is very, very important. Wash your hands frequently at every chance that you get, and avoid contact with sick individuals. As well as while eating, there is also especially in the raw food or undercooked food, they tend to carry bacteria like salmonella, listeria, all of those. And being immunosuppressed, you're at higher risk to develop these infections. So just try to check what you're eating. Okay, next one, please. Here we have all the vaccines that are recommended by the CDC for patients with lupus and immunosuppressed to have. Influenza has to be taken annually, and this is important because we already mentioned that the flu is the one that triggers the lupus flare. So if we can avoid that, that would be great. Pneumococcal vaccines, also COVID vaccines, hepatitis B, hepatitis A. If the patient are at risk or they're traveling or they're exposed, that is the hepatitis A. Otherwise, we don't do it routinely. Tdap vaccine, stay up to date every 10 years to take it. HPV. And actually, this is important, especially in the young girls, because the lupus patient tend to get this infection, and then also HPV, we know that can cause cancer. We ask the patients to get screened for the HPV through their OBGYN and get vaccinated. And the age usually it's from 9 years old to 45. Shingles and zoster as well. Before it was only if you are more than 50 years old, but now everybody who is more than 18 years old with an immunosuppressed, then they have to get vaccinated. There is a question, I didn't bring it here, but there is a question about the live vaccines, MMR, for example, yellow fever, and some other live ones that we tend, if you are immunosuppressed and you are taking medications, we don't want them to be done, and you have to, while you are on that medication, and you have to sit down and discuss with your primary how to manage and for how long you have to stop the medications before or after those vaccinations. Okay, next one. Okay, stay healthy, stay physically active with lupus. Dr. Ahmadzadeh already brought some great exercises to do, but the ones that are also low impact. This is the key with lupus, low impact. If you overexert, you're going to put your body into stress and flare. But if you take it slowly, like walking, swimming, light strengthening training, cycling, that is great. And if you don't know where to start, you can always ask for a physical therapist consult, and they will tell you. Okay, next. Medications already, I guess, talked today. But my only advice here is do whatever works for you. Set daily reminders, use pill organizers, or the important thing is for you to keep taking the medication and do not stop it suddenly. Because once you stop suddenly, you might get flares. And so the key is also to kind of taper and take them as prescribed. Okay, next one. Stay up to date with medical checkups. Come check with us. Go with your doctor every 3 to 6 months. Follow all of them. Repeat blood work, because this is how we this is how we manage your lupus. This is how we check how you are doing. If your blood work shows that you have some abnormalities, that might be a flare, and we can catch it even before you can feel it. And so it's important to adjust your medications. You have plenty of support. Please don't be shy. Ask your nurses, your pharmacists, your doctors, whoever you feel comfortable. That's it. With help with medications, help with questions. Never be shy. And because we are here to help. Okay, next. And my last advice would be try to get as much support, because there are a lot of studies that have shown how the support from family, from friends, and from the healthcare helps managing lupus. Obviously, when you first get a diagnosis of lupus, is not an easy diagnosis. You don't have enough information, and it's a chronic illness that affects mentally, physically. So it's so important to know that you need somebody and to ask for help. Okay, and know how things that you have to do. Also, practical support, like sometimes doing other things that take off your mind, or following your hobbies, cooking, cleaning sometimes also can help reduce, the flares and make your body feel good. Workplace accommodations as well. Some patients with very severe lupus and the joint pain and so on, sometimes all you need is some help to work less hours, or remote work, or have other accommodations at work. Your doctor can help with that. And then social support groups. Most of my patients have found that they are either in Facebook or Instagram. And, it really helps having other patients who share the same experience and who share the same, connections, get encouragement and advice. It is always great. So please use all those resources. Okay, and I think that was my last one.
Thank you, Dr. Mirashi. That's great information. So much packed into your presentation. I want to be respectful of time. So I feel like we were getting a lot of questions, and then you would answer them throughout the presentation. So that's
okay.
Which is great. So I'm going to kind of skip over those, but there are two that I do want to make sure that we address. One of which is somebody was asking about dental procedures triggering flares. And is there any way to prepare for both routine and more intensive dental care?
I think that is a great question. And I just I would like to touch base on that, you know, in your mouth there is a lot of good bacteria and bad bacteria as well. So that it happens, you know, with the cavities and with the procedure, that balance that they have, it might get affected. Well, I don't know exactly how you can prevent, but I guess dental hygiene and following with your dentist would be one of the best ways how to take care of it. I don't have much information about that part, but I know that is also a very good part of triggering lupus flare because of that dysbiosis.
Yeah, I think just you hit the nail on the head when you said basically you got to stay seeing your dentist and making sure you're staying on top of your oral care for so many reasons, but one of those of which is preventing flares. So
Yeah.
okay.
I guess patients, immunosuppressed patients, lupus, they have to do the double of work of the healthy population.
Yeah. And so many of us also have Sjogren's. So it's, you know, it's just kind of like
exactly.
another
Yes.
thing.
Yes.
It's just another thing. Right?
Yes.
Okay, one last question right here. Somebody asked specifically about ashwagandha. Is it bad for lupus patients to take ashwagandha?
No, actually, that is also a very good supplement that helps, reduces flares, has anti-inflammatory properties. But I would just bring up that ashwagandha has a lot of interactions with the medications they are taking. So this is the part that they should focus. If you are taking blood pressure medication, it can like interact and sometimes reduce effectiveness. And then there is some classes that now I don't remember all of them, but I usually like to sit down with my patient when they tell me they're taking these supplements and run their medical list that they have and then check and discuss together. But otherwise, if you are not having like plenty of medication, that is great for you.
Okay, great. Well, if there's any questions we didn't get to today, by all means, you know, you can ask them in the comment section or email one of us at the office, and we can do our best to get it to the appropriate physician. But thank you, Dr. Mirashi. Wonderful presentation. We really appreciate it. And if you'll just bear with me for one more minute, I just want to kind of give a wind down and then we'll be done and you can go about your day. So this concludes the Rise and Thrive Virtual Lupus Summit. Again, thank you to the state of Ohio and the Ohio Department of Health for support of this program. Thank you also to our expert panel that joined us today to help lupus patients live a better quality of life with their disease. Finally, thank you to the patients, caregivers, community members, and healthcare providers who attended today. We appreciate all of you. Please remember to complete the evaluation. We will send it to your email shortly. Not only does this help us fund future programming, but you will be entered into a drawing to win one of 2 gift cards. The first is a $50 gift card to Sephora, and the second is a $50 gift card to Starbucks. So please help us by taking a moment to fill out the evaluation. I'd also like to take a brief moment to shout out our upcoming lupus walks here in Ohio. They are a driving source of funding for our foundation and the good work we do. The Cleveland Walk to End Lupus Now will be Saturday, May 3rd, 2025 at 10 a.m. at the Flats East Bank. And the Columbus Walk to End Lupus Now will be Saturday, June 28th at 10 a.m. at COSI. You can register on our website at lupusgreaterohio.org. And another wonderful event coming up is our You've Got It Right Minority Retreat, Saturday, April 12th. That will be in Lyndhurst at the Hyatt Place. That's one of my favorite events every single year. So please visit our website or go to Facebook to get more information. And if you want general information about lupus, or if you want to speak with somebody or get connected with a patient navigator, you can sign up for our emails, visit our website, give us a call. We are at 1-888-NO-LUPUS, and you can reach us Monday through Friday from 8:30 to 5 p.m. We're committed to providing you with the most accurate information as it becomes available. Be safe and continue to strive to find optimal health. We hope to see you soon. Thank you.